The prime drivers of medical inflation in South Africa are the cost of hospitalisation and medical specialists. Recent research shows that actual cost of medical items have not increased dramatically, and consumers are benefiting from the increased use of generics.
Medical inflation is much higher than the inflation rate of 6.6%. The high cost of hospitalisation and specialist private doctors are said to be the main culprits for this. Only about 8 to 9 million people belong to a medical aid, and that means the majority of South Africans can simply not afford these increases. It's believed that the introduction of the National Health Insurance will help turn things around.
The introduction of the NHI, I think, is a positive thing. It will be a key driver in increasing access to medicine and healthcare for the broader population. However, that being said, within the private sector, there is a healthy tension that exists between the funders of healthcare and the providers of healthcare. So the whole process around healthcare provision is not an uncontrolled thing. You know, healthcare funders have got an interest in trying to contain healthcare costs. And I think the current study shows how effective they have been in keeping the increase in medicine inflation below the general consumer inflation numbers.
Recent research conducted by pharmaceutical company Mediscore has revealed that medical costs have increased by just over 1.9% for the first time since 2011. But this study covers less than 5% of the population and is centered around the private healthcare market. New chemical products, defined as innovator medicines, are the major drivers of medicine expenditure. They are still under patent and have no generic equivalents. Medical aids are encouraging their members to use generic medicine in a bid to curb costs. The use of generic medication increased from 53.4% to 54.5% in 2013.
South Africa has done well at 54%, but when one compares it to what can be achieved in the USA, the generic utilization rate is 70%. So the country can still do a lot more to improve the generic rate. Generics are essentially a copy of the original product. They are launched once the patent of the product, the original product, expires. So they have the same active ingredient and it has the same impact. So to take a generic, I mean, those products are registered with the Medicines Control Council and they are safe to take. The average generic is on average about 30% cheaper than a branded product. So the more generics you use, the further your money lasts you.
The single exit price does set a cap on maximum increases pharmaceutical companies can introduce on a monthly basis. In 2013, the Department of Health permitted a maximum single exit price increase of 5.8%.
The government has been very effective in utilizing and implementing the SCP framework, which has assisted in keeping the cost of medication down, but you can't see it from that perspective only, all right? You've got to take into account that overutilization will also drive the cost of medication. And within the private sector, as I mentioned, there are a number of programs have been implemented to reduce wastage through overutilization, duplication, fraud, etc.
Only about 10% of doctors are able to dispense medicine in South Africa.
It's really as a result of two main drivers. The first one has to do with the fact that the doctors have to apply for a license to dispense medication. That you can't just finish your studies and open a practice and then start dispensing medicines. The doctors need to apply to the Department of Health for a dispensing license. And another very important factor that influences the results are, by and large, the medical scheme members. One would find in the cities, and similarly you would also find pharmacies in the cities, whereas dispensing doctors are more inclined to be in rural areas.
Government is in the process of finalizing a bill aimed at replacing the current Medicine Control Council with a new regulatory body. The council has been criticized for slow turnaround times. However, it's received praise for regulating medicine prices and ensuring that pharmaceutical companies do not inflate prices as and when they deem fit. Naledi Mulifi, SABC News, Johannesburg.